Let's flip through to the 24 days latest report. This doesn't change, by the way. This is what do you call it, propaganda? Call it what you want. Hasn't changed. This does. Total adverse events. Small country, small city, but 111,000 reports. And I mean, I don't know where this number comes from. There's 26 million in Australia. They're saying everyone's had 2.2 jabs. Most people I know haven't. So someone's telling a porcupine. And what really is perturbing is these figures, which I believe are probably a little bit unsubstantiated when you read through it. TGA's adverse events in these 5 to 11-year-olds. They say they have 715 reports per 1.1 commonality. Let's go and check it, okay? And one report possibly representing mild pericarditis. Well, let's just fact check that, shall we? There we go. Because they've only found, according to the safety report, if you read on, 11 deaths from 700. Have an autopsy report for 6 months. But one would ask, why the hell not? She was a 23-year-old woman when she died, who claimed to her mother that I'm not well since I've had this jab. And yet the coroner, in a state of emergency, can't produce a report. Pretty weird. Let's just check it out. Let's just go from January this year to this year and check out the kiddies, shall we? So in Australia, it came in on the 10th. Let's give it a couple of days grace. Search. Let's just put in here. If you haven't done it, it's pretty simple to do it. As I said, don't bother keeping reports. Take screenshots because it shifts like sands. Oh, jeepers, that figure's a little bit different, wasn't it? They said 1 case of mild pericarditis. Anyway, let's go to the list of reports. Now, this is where, deaths, 16. 16 reported deaths. And remember, I just did the 12th, so less than a month into the year, a couple of public holidays, and children now being stabbed. A bit shy under 6,000 reports, 16 where death was an outcome. Did not race it through. Let's go with age lowest first, and this is traumatic to see if you haven't seen this before. Remember, every age is traumatic. That's a lot of people, a lot of cases that have been recorded in Australia due to this. So these people don't have ages listed. You don't have to go too far in. I don't know why they don't list ages, by the way, but anyway, let's go to next. 60 pages of people in this country in 4 weeks have, through their doctors, had adverse events reported. And some self-reported. It's pretty hard to self-report when you've had a troponin rise. Like that's something a doctor would do. So it's just blood pressure systolic increase. I can't imagine that a person has self-reported that. That sounds like a medical report. Meh, what would I know? A little bit frustrating, but soon we'll see when the young folks start. Incorrect dose, vaccine error, seizure, meh, I don't know. The number of times I've read that and usually end up in tears as to know that they're a part of this, that they're potentially giving someone asthma, chest pain, electric shock sensations. Wouldn't they be interested in this? They're the ones who are allegedly getting people to consent to a phase 3 experiment, which is when you give informed consent, which means you, 1, do no harm, but 2, informed consent means you are obliged by law to highlight potential harm. I'm sure they all are. Pretty bad there's no ages, sorry, and this is the problem when there's so many numbers. Menstrual disorders. Remember the doctor down in Canberra who knows his stuff, and spontaneous abortion has gone up 600%. There's as I've said, number one, you shouldn't be driving a vehicle. Pull over now, catch public transport, because clearly if you can't work this one out, then you shouldn't be driving a vehicle of potential mass destruction. Secondly, if this doesn't make you sick to the bone, you've lost your heart. So, I'm 6 or 7 pages in. So this is Australian data in a 4-week period. 4-year-old female on 4-year-old who's jabbing 4-year-old. Hello? It's not even freaking listed for that. Oh, yes, here we go. Vaccine error, inappropriate age. Inappropriate age, vaccine error, vaccine error. Jeepers, I hope the doctor who signed off on that has now been deregistered. What are the chances? 5-year-old lip discoloration, pallor, vomiting, rash, vomiting, chest discomfort, chest pain, a little 5-year-old boy. I don't know if you last held a little 5-year-old kid. They're so cute. Angioedema, swelling of their face, syncope, this person fainted. Rash, vomiting, syncope, nausea. These are little kids who, even according to the altered ABS data, don't get it. Remember, the average age was, what was it, 83 or something like that? What was it? Average death was 10 years old. Another 5-year-old rash, cough, throat pain, enterocolitis, so gut stuff. Another drug error. Jeepers, nothing could go wrong in an experiment stuffing it up for a little 5-year-old kid, could it? Well, they got a blood sugar increase, diabetic ketoacidosis, potentially life-threatening. Kawasaki's disease, what? Another drug error. Throat irritation, rash, vomiting, abdominal pain, a seizure. That's called a fit. This 5-year-old kid had a seizure. He was never, ever, unless he was previously unwell, going to be at risk of this virus. So the doctor, the nurse, the parents have thought it was in his best interest these kids now had a seizure. Vaccine error, fainting, swollen face, nystagmus, that's when your ears go stupid and you get vertigo, dizziness. Tonic convulsion, that's when your whole body jerks in a seizure. Basal ganglia hemorrhage, or brain hemorrhage. Vaccine error. No, anyone who says, oh, but these are just reports and anyone can self-report. I don't know any parent of a 6-year-old who's going to write in and write rash erythematous. Like, hello, these are medical reports. When are people going to start putting the dots together and say, leave our kids alone? Down at the office at 10 to 5, be having a few whiskies on his way out. Why state of emergency? And he's approved all this, jabbing our little children. So a 6-year-old boy has had a cerebral vascular accident. That's a stroke. You for real? Anyone thinks this is okay? SVT, they've had a troponin increase. This 6-year-old boy has had heart damage. You think that's okay? 6-year-old girl, STE segment elevation, troponin. STE elevation means that there's ischemia happening to her cardiac tissue, heart tissue. You think that's okay? She might have got the cold and had a day or two in bed. They don't transmit it. There's no evidence to suggest that. And healthy children, as many of the specialists around the world, the 16,000 doctors who make up the Health Alliance have said over and over again, children are not at risk of dying from this if they're healthy. And here we are harming them with an experiment. Inflamed heart tissue. say, I'm wrong here? When are doctors, nurses, and other people involved in this scheme going to say, enough's enough, this is going to stop? Only you can answer that. I'd like to think it's today, right now. It doesn't make sense. Anyway, love. Bye-bye.